At the beginning of this month, the Utah Health Exchange opened for businesses with 2 to 50 employees with coverage beginning January 1st, 2011. Here to discuss the benefits of the exchange is Matt Spencer. He's the program manager for the Office of Consumer Health Services under the Governor's Office of Economic Development. That basically means he's the man charged with running the Utah Health Exchange. Matt, thanks for joining us.
Thanks, Marty.
Yeah, I think the top concern for businesses when they look at health coverage for their employees, one is providing it and being able to draw employees, but I think it'd be lying to say that cost isn't a big concern. The exchange is designed to help drive down that cost, but you want to make sure people understand we're not talking about a silver bullet here. It's not happening overnight.
That's exactly right. Ultimately, the direction we want to go is lowering the cost of health care. But we have to understand that the Utah Health Exchange is one cog in the wheel of Utah health system reform. So really, we're focused on 3 pillars right now that they'll help drive that reform efforts. One is provide additional choice to consumers, defined contribution for employers, and allow employers to have a premium aggregation within the exchange. So those are features that don't exist in the open market, but we're bringing to the table within the exchange.
Other cogs in that effort are electronic medical records, tort reform, things along those. But if I'm a business owner, I'm thinking, why do I need to get in early? Are there benefits for me to get into the exchange now, or is it better to wait?
No, absolutely, it's a good time to get in now. Right now you have the choice between the 2 markets, but those 3 pillars you can take advantage of right now to get you on that track to start realizing some future savings down the road.
And I want to go through those 3 objectives, the 3 things you're trying to accomplish this time around with the Utah Health Exchange. The first being plan choice. 70 plans offered last year, and that number has grown quite a bit.
That's right. That's right. This year we have over 116 plans in the exchange to choose from. So we have a wide array of choices for consumers to pick from within the exchange.
Have you been surprised at all by the amount of choices being offered? How many people want to participate?
Absolutely. We were anticipating the same number of plans, maybe a few more, but the carriers have just opened up and are very excited to compete and to offer additional plan choices to consumers.
Now, for business owners watching this, we want to make sure they understand that defined contribution is the key to their participation. That's the draw for those businesses. Tell me a bit about the defined contribution.
Absolutely. The defined contribution allows employers to set a dollar amount, fixed dollar amount, wherein their employees can go into the exchange and purchase any of the choices within the exchange. The benefits to the employer are predictable costs, so they can say at this point, I can't afford to pay for this rich plan for everybody, but this is what I can afford, and this is what I can contribute. And next year, I'll budget a little bit more. Then from there, you can make decisions based on your needs of how you want to do that. So we believe that's going to allow employers to control their costs a little bit better, and also employers that haven't been able to participate in health insurance in the past now have the opportunity to at least contribute something to their employees' benefits.
The third objective there is a big insurance term, premium aggregation, and I think people would see that in their eyes may glaze over. Premium aggregation, tell me a little bit about exactly what that is and how it works.
You bet. That's really just a pooling of funds. If there's a part-time employee that works 2 part-time jobs, with this premium aggregation feature, that employee can take contributions from both employers, contribute to one medical plan. It also works for spouses. If a spouse has coverage through their employer and through your employer, you can take both contributions and apply it to one plan. So this is also driving in the direction of making plans more affordable for employees by aggregating together contributions from multiple sources. It also includes government subsidies through CHIP and UP and Medic.
Yeah.
Yep, all those subsidies are going to apply in the exchange as well.
So if I'm a small business owner that maybe is offering some type of health coverage, but 3 or 4 of my employees don't take it, they take it from their spouses, and they're covered through their spouse's employer. Does that give me cause for concern that now what they've been declining, now they're going to take the money that I've been offering to contribute, calling my bluff maybe?
It might, but it also protects you on the front of dual coverage. A lot of people think that by being dual covered, they're twice better off, and that may not be the case. So you can actually, as an employer, you needn't be alarmed about those that are waiving. You still have the ability to have employees waive for legitimate coverage elsewhere. That doesn't hurt hurt anything, but it does allow your employees to, rather than just taking your health plan just to take it, they can contribute to another plan that makes it more affordable for them.
I mentioned when we began that the exchange is open for benefits or coverage starting January 1st of 2011. That doesn't necessarily mean that if your benefits don't start January 1st, you're out of luck. Just tell me a little bit about how the rolling period works.
You bet. The exchange is open for business and it doesn't close, but we do have an enrollment period September 1st to the 15th for coverage beginning January 1st. But if you want coverage effective February 1st or any subsequent month, there's a 90-day window that's rolling. So you need to enter the exchange 90 days prior to your effective date.
September 15th coming up pretty quickly with about 1 week left. How's it going so far?
Very well. We have a good response from the community. Employers are interested, and we're excited to be demonstrating the Utah Health Exchange.
Matt Spencer is the man charged with running the Utah Health Exchange. Matt, thanks for joining us.
Thank you.
And if you want more information on the Utah Health Exchange, you can find it online at exchange.utah.gov.